You're very welcome. You're very welcome to this week's attention-based training. So we're at week 3 now. So I hope you've had a chance to get loads of practice under your belt, and you're looking forward to a lot more meditation this afternoon. And maybe, who knows, you might be seeing little bits of improvement in what's happening with you over the last couple of weeks. Hopefully you are seeing something. But just to point out before we go into it that the number of minutes that we're practicing at the moment might be a little bit suboptimal in terms of seeing movement in, psychological or physical health. Okay, so I just want to start just by pointing out this fact here, that normally when I'm doing these 8-week programs, I'd be doing them for clients or for patients. And it's normally in a setting like this, so we're all in a circle and we're having a chat. And by week 3, really, I'm doing very little talking. I might introduce the topic for the session, and then everybody in the circle starts commenting on how their practice was and things like that. Now, I know this format doesn't allow us to do that, but I thought at the end of the Q&A session, once we're finished going through the slides, that if we could get at least 1 or 2 people just to come onto the chat platform and just bring any kind of issues that you might have had with the practice. Now, I put there at the bottom, unless you're having no issues at all. So if you have managed to get 3 minutes morning and evening every single day over the last week, that's great. But there might be 1 or 2 of you who haven't managed to get that. So really what I want to do is I just want maybe 1 or 2 people just to come onto the chat and tell me what your issues are, if you're having issues with certain things, and maybe we can go through them and try and provide some solutions. And maybe individuals who are actually tuning in can offer their own solutions on the chat forum. And I find, in terms of what I normally do in the circular format with people and patients, is that we kind of solve these issues together. So your question actually might be very beneficial for everybody else who's in the chat room today, but also people looking at the recordings subsequently. So just to remind you, if you do have any issues with practice, let's say you're finding it hard to do it in the morning or the evening, maybe if you can just bring that up at the end. We only need 1 or 2 people just to highlight it. Okay, thanks for that. So I want to start by reminding you about a little recap of last week. So last week was really about how to generate the habit. So I gave you a few tips and tricks of the trade based on current research practices on how to formulate a sticky habit, a sticky positive habit like your ABT practice. And if you haven't filled out these templates, I would really urge you to go back, look in the manual, and fill out these templates for yourself, because they'll really help you embed your practice, and it just makes it a little bit easier. And just to remind you as well that it's not good enough really just to have a practice for the working week. You also need one for the weekend. As I said, if you're on shift work, well, then you need 2 different types of practices as well. If you're going on a conference, which I know you won't be now, but maybe you will be in a few months, then you need different practice regimens for different activities. So if you haven't done it already, maybe this evening, 30 minutes, take some time just to fill out these templates. You don't have to copy exactly the template here, but you get an idea of what we're trying to look for. So we're trying to look for a trigger, we're trying to look for a routine, as you can see here, or a reward. The reward, as you might remember from last week, is very important. So we gave some examples like a coffee in the morning, or maybe something like a nice book or a hot chocolate, or maybe a Netflix show in the evening. So give some thought to that if you haven't already. It just helps develop your practice. And I'm just going to go briefly through the behavior change checklist again, so you can see, well, have I actually been looking at these aspects of developing a new habit? Maybe I need to give more attention to these in order to make my habit stick. So what we discussed last week were the idea that you needed to create the proper context and environment for your practice habit. So hopefully you will have identified the chair at this stage and the place you like to practice. And we talked about moments to leverage a new practice, and we all know that the leverage moment right now is a pandemic. And then this idea of piggybacking existing habits with the new habits you want to develop. And the example here I gave was brushing your teeth in the morning and evening. If you want to piggyback on an existing habit, you introduce the new habit before the existing habit. In other words, you're piggybacking on the existing habit. So that's important. If you have habits throughout the day that are really stuck in there good and tight, well, then it's good to piggyback with the new one. And you need to make this as easy as possible. So you need to identify the barriers and facilitators to practice and remove as many as you can. This is normally about timing and other people generally. And then we talked about the habit loops in the previous slide. Again, that's to remind you of the trigger, the routine, and the reward you're going to give your brain for doing something that's not always easy. And then again, the rewards, as I said, we often focus on the short-term rewards like coffee or Netflix, as I suggested, but they can be long-term as well. So you can think about something nice to do at the weekend. I know you can't go far at the moment, but maybe this comes more into play when restrictions have been lifted, for example. You can promise to go for a nice walk on the beach, if that's allowed to us in a few months. And obviously practice, practice, practice. And the last thing, as I said last week, which many people ignore, is to attribute meaning to this practice. So when you're generating this new behavior, why are you doing it? Ask yourself that question. Are you doing it for yourself, for your children, for work? Try and identify where the meaning and purpose is in this practice. And again, it's more likely to stick. Okay, so I'm sure it should become routine now that before we go into the new material of the week that we practice a short body scan. So as we always do, we assume the nice upright position with your feet planted on the ground, and you can have your hands resting by your side or in your lap or whatever is most comfortable. We adopt the upright position, which is not rigid, but it's upright, so we don't go into sleepy time. And you can close your eyes or open your eyes. It's probably easier to do the body scan with your eyes closed because that's one less distraction. So now that you're sitting as comfortable as you can, I want you to take one deep breath. Hold it for a moment. And then exhale slowly. So as always, we begin the body scan by bringing our attention to the toes of the left foot. We try to get a sense of the individual toes, the big toe. And then we move our attention to the sole of the left foot, the left heel, the top of the foot, and the left ankle. And from the left ankle, we move up slowly through the left calf muscle. And remember, each time we arrive at a muscle group, we try to consciously relax this muscle. We rest for a moment on the left knee. And from the left knee, then we move slowly up through the large muscles in the left thigh, relaxing them as we go. Until we arrive at the left hip. From the left hip, we go across the pelvis and down into the toes of the right foot. And you'll try and get an impression, a sense of your entire right foot. So from the toes to heel, ankle, top, sole, your whole foot, one unit. Remember that each time you become distracted, you just come back to that area of the body that we're focusing on. Just continue to breathe as normal. So from the right ankle, we move up slowly through the right calf muscle until we reach the right knee. And then from the right knee, We consciously relax the large muscle groups in the thigh. As we move up into the right hip. And around to the base of the back. So from the base of the back, we move up very slowly, either side of the spinal column, consciously relaxing the muscle as we move up. Once you eventually arrive at the shoulder blades, just pause there for a moment. And then from the shoulder blades, we move up into the large muscles of the left shoulder. So relax this muscle here, which is often tense. And from the left shoulder, we move down into the tips of the fingers of the left hand. Sense your whole left hand as one unit, from the tips of your fingers to your left wrist and your thumb. From the wrist, then we move slowly up through the left forearm, the left elbow, the upper arm. We feel the entire left arm from the shoulder to the fingers, again as one unit as it hangs from your shoulder. And then from the left shoulder, we move across to the right shoulder, where again we consciously relax the muscle group here. And we move down the right arm to the tips of the right hand. Feel the hand as one unit. As we move from the right wrist through the right forearm and elbow into the upper right arm. We get a sense of the whole right arm from the shoulder down to the tips of the fingers as it hangs there from your shoulder. So now we move around to the back of the neck. We get a sense of the weight of the head as it sits on your neck. And we move slowly around to the jaw, either side of your face. Relax your jaw muscles. Move up either side, past your left and right cheek, your temples, your eyebrows. Soften the muscles around your eyes. And then bring your attention to the back of your head. And then move slowly up to the scalp at the top of your head. Notice any sensations there. So before we finish, I want you to get a sense of your whole head as it sits on your neck. Feel the weight of your head. Then we'll take one deep breath in before we finish. Exhale. And then we open our eyes, and that's the end of the body scan. So hopefully you're nice and relaxed and not asleep. We go through the topic of today. So we have a number of topics for today. And to begin with, I want to just bring you through a whistle-stop tour of the biology of stress. I'm not going to bore you about the intricacies of the biology and neuroscience. I'm not a neuroscientist anyway. I'm an immunologist by background. I know a little bit about the biology of stress. The reason why I want to talk about the biology of stress is so that you can have an understanding, a basic understanding of the symptoms that occur in all of us when we're experiencing stress and anxiety over short or longer periods of time. And sometimes it can help us understand these things that are happening within us. And really, this is all in connection with the attention-based training program, which is designed specifically to put balance into these systems. So we have research data that shows that the systems I'm going to describe to you today can be balanced and reset by attention-based training and other types of meditative practices. So let's begin with a little bit of a very brief tour of the impacts that stress can have on the body. Now, there's a lot of symptoms described here. They're not all going to emerge over stress that happens over a week. It's important also to emphasize the fact that stress is actually good, and I'm sure you might have heard that before. If we didn't have stress, we wouldn't get up in the morning. Stress has allowed us to evolve as human beings, and we needed to be ambitious. We needed to be good parents, to be good citizens, and we needed to be good at work. So stress can be good, but the problem is when stress is allowed to become uncontrollable and unmanageable, when it largely stems from the mental side of things, from mental perspective, and from cyclical thinking about anxious things such as a pandemic or the future or ruminating about the past, then we move into a more chronic state, which really can be said to last longer than 6 weeks. So 6 to 8 weeks, anything lasting longer than that, now we're entering into a phase that can actually slowly damage the body over time. And that's what these symptoms are. Now, you may have experienced many of these symptoms before. They may not have all been associated with stress. And this is just really a summary of all the things that can emerge from prolonged stress. So I would have done some work with colleagues in James's Hospital at the moment with chronic urticaria, which is a chronic itching disease. So the skin can be the first port of call in many cases in relation to stress. And you do have a lot of chronic skin issues that do emerge or get worse as a result of stress, such as acne and psoriasis and eczema. The stomach is an obvious one. We all have anecdotal evidence, I'm sure. You know, people who have experienced IBS and IBD and cramps. It's one of the first things that happens, many of us, when we just get slightly stressed anyway as a result of adrenaline. But this really can become a big issue for many people over time, and it can be a very debilitating thing to experience. The pancreas starts to produce a lot of insulin over prolonged periods of stress. And this has knock-on effects to glucose in the system and can lead to weight issues and obesity, which is also sometimes associated with prolonged stress. The immune system is something I'm interested in and can be profoundly impacted by stress. And this is just not anecdotal evidence. This is actually real data from the literature. The head is an obvious one. Our mood can change in response to stress. We've all felt this. There's nobody alive who hasn't experienced stress that hasn't impacted their mood. Unfortunately, if it goes on longer than the 8-week phase that I talked about, this can lead to more serious things like chronic anxiety or even depression. It can certainly impact our concentration and our focus. The cardiovascular system, again, is an obvious target of the stress system, and most of us would be aware of that. Usually manifests in high blood pressure over time, high heart rate, and then over prolonged periods of time, it can exacerbate cardiovascular disease. The intestines, obviously linked to the stomach and IBS and IBD and things like that. Here we're talking about malabsorption of nutrients, which can be an important issue over time, and impacts metabolism as well, which can link into obesity. The reproductive system is also impacted in terms of low libido, low fertility, decreased hormones that we all need for our working body. And then joints and muscles, and this is something that many people would experience over long-term stress as well. So you have aches and pains, muscle strains. If it goes on for a seriously long period of time in terms of years, it can actually have an impact on bone density. So all of these symptoms have been documented in terms of short-term, long-term stress and the impact on the body itself. And I'm sure you would have experienced a number of those symptoms. So I just want to, as I said, briefly go through the different aspects of stress. I'm not going to give you a lecture on stress hormones or anything like that, but I just want to briefly introduce the main players in the stress response. And probably the biggest player initially is the stress hormone cortisol, which is an immunosuppressant. And what we have here, this is called the HPA axis in the brain, which is activated by stress. And that stress can be mental stress in terms of internal stress, or it can be environmental stress. And this system can be activated within seconds. Then we have a lot of precursor hormones that are secreted into the bloodstream or at the end of nerve ganglions that activate the adrenal glands. And we have a number of other hormones produced, but the big player in terms of the stress here is cortisol, which, as I said, is immunosuppressant. The other players in the stress response here, again, just briefly, are adrenaline. Everybody's heard of adrenaline. It's called epinephrine in America. Noradrenaline is its counterpart. Again, both of these are involved in the stress response, and acetylcholine is obviously involved as well. So again, I don't want to go into any great detail here. I just want to highlight the main players. We've mentioned dopamine before in terms of rewarding your brain. Your brain likes dopamine, so you can see we have pleasure underneath the word dopamine here. And I'm sure you would have all come across serotonin, which is what many people call the happy hormone, which is important for mental health. So in terms of those hormones that I looked at, what impact can they have on the immune system? So again, I'm not going to spend too long on this complicated illustration here. But again, what we have is an activated brain in terms of a stress response. And we have the HPA axis being activated. And we have these hormones being produced by the adrenal glands that sit on top of the kidneys. So again, you might see down here, we've got glucocorticoid, which is cortisol. That's the stress hormone that we talked about. And then we have these other hormones, adrenaline and noradrenaline. And the bottom line here is that there's a lot of research to show that these hormones can really conspire to have a significant impact on the immune system in the short period of time, when we have research to show that in emergency department staff, but also over a longer period of time. And it can have different detrimental impacts on the immune system. I'm not going to go through all these different immune types of cells here, but suffice it to say that something that's called a natural killer cell will be necessary for fighting off different types of infection, particularly bacterial infection. And what we find in prolonged stress, that these hormones have a negative impact on the cells that we need to fight infection. And this can obviously be a problem over prolonged anxiety periods. And we have a decrease in antibody production, cytokines, which are the molecules that are your first line of defense against bacterial and viral infection. And maybe anecdotally, some of you would have experienced a re-emergence of things like the VZV virus, which causes chickenpox and shingles. And you get reactivation of latent viruses that might be in the system. So the bottom line here is that the stress responses induce hormones that can have a negative impact on the immune system. It doesn't completely debilitate your immune system and shut it down completely, but it has a softening impact on it, which obviously is not good over the long period of time. In terms of short, sharp shock and stress, I'm sure most people are familiar with the fight, flight, or freeze response. And this is largely associated with the hormone adrenaline. And again, I'm not going to go into too much detail here, but I just want you to recognize these terms if you haven't come across them before. Obviously, if you're in a clinical or scientific field, this might be old hat to you, but I just want to go through it briefly. In terms of the fight or flight response, it has a lot to do with what's called your autonomic nervous system, which has a lot to do with what we've just referred to as adrenaline, the stress hormone. There are really three aspects, which are fight, flight, and freeze. But more often than not, people would really mostly talk about the fight or flight aspect or the rest and digest. And these are two different sides of the autonomic nervous system. So one is good for recuperation, obviously, as the name suggests, the rest and digest component, or the fight or flight. And you would have experienced these symptoms over time. But the bottom line here is that if you experience these symptoms over a prolonged period of time, that's when they can have negative impacts on the system, like the immune system. So you would have experienced the adrenaline fight or flight response in terms of dilated pupils. You would have seen it in other people, accelerated heart rate, a relaxation of the lungs to try and get more oxygen in to feed the system. The digestive system gets switched off in this case. We get stimulation of glucose production that floods the system. And as I said, we get secretion of adrenaline and noradrenaline, these stress hormones, to really rise to the occasion in terms of this external stressor or internal stressor. Where we want to go in terms of the attention-based training program is not to eliminate fight or flight, because we need that to be alive in the world, but to actually give more time to the system to live in the rest and digest state. And when we engage in any type of meditative practice, including attention-based training, we're spending more time in the rest or digest component. And this is more involved with hormones like acetylcholine, which are part of what's called the parasympathetic system, which is a calmer state for the body. And this slows down the heartbeat, as you can see from the symptoms here. So it's really the opposite of what adrenaline is doing to the system. It calms the system down, it improves digestion, it improves metabolism. So in terms of the cardiovascular system, I'm not a cardiologist. I'm just want to highlight these phrases here. And the one I want you to remember is respiratory sinus arrhythmia. So many people might not realize outside of medicine and science that when we inhale, our heart rate increases imperceptibly. And when we exhale, this heart rate moves down. So you can see in these graphs here, you don't have to worry about the axis titles, that when you inhale, your heart rate is increasing up in terms of beat per minute. And then when you exhale, it's coming down again. If you're in an erratic state, if you're anxious, if you're angry, if you're upset, your breathing will be irate, your breathing will be rapid most likely, and it won't be even in terms of inhalation and exhalation. And you get this kind of jagged pattern here that we see. If you engage in some kind of meditation-like practice, like attention-based training, what you'll find is over time that your breathing will regulate. And maybe some of you have started realizing this already, that your system automatically starts giving equal time to the exhalation and the inhalation. And what this is doing is it's balancing out the two sides of your autonomic nervous system, which is balancing out the RSA, or respiratory sinus arrhythmia. So what happens when we give more attention to an attention-based training kind of program is we get this kind of pattern here, which is smoother. And again, you don't have to be a cardiologist to realize that one is more aggressive looking and one is calmer. So the bottom line here is that I just wanted to take you, really emphasize the point that the attention-based training leads to a regulation of breathing. It equalizes inhalation and exhalation times. So let's say 6 seconds or 10 seconds on each. And that regulates the RSA, which regulates the cardiovascular response, and the autonomic nervous system, which dampens down the stress hormones and induces balance into the system. I think I've shown you this in week 1, where I was talking about when we get anxious or during the fight or flight response, we get more of activity and increased activity in the emotional centers, in the amygdala, in the limbic system. Where the prefrontal cortex, the part of the brain that we need for cognition and for learning, tends to reduce in activity, or more energy is given to the limbic system. So if we are in a situation where we need to think on our feet, this obviously is not a great thing. So you can use your attention-based training to reverse this process and restore activity to the prefrontal cortex. And I don't know about you, but I can always need more activity in my prefrontal cortex. It also helps with focus and memory and attention. And the clue is obviously in the name in terms of attention-based training. The more attention we give to this kind of training, the better the balance between our limbic and emotional centers and our prefrontal cortex and our thinking and cognitive centers. Okay, so that's the brief whistle-stop tour of the stress system. Obviously, you can read an awful lot online. I've given you some references in those slides, and if you want to learn more, you can go into those references. But I just wanted to point out really the important symptoms that emerge from stress and anxiety. And maybe you're experiencing some of them now. Maybe you know people who are experiencing some of them now. They're common, they're normal, and they can be managed and dealt with something like attention-based training. The bottom line is we don't want these kind of hormones to be produced on a chronic level where they start impacting our other systems like the cardiovascular system and the immune response. So that's the brief biology of the stress system. What I want to talk a little bit about now is distractions, and I'm sure you've all experienced distractions from the very week one when we did it. I'm sure you experienced them when we're doing the body scan during any of the sessions, or when we do the 2-minute practice towards the end of the session. Distractions really are ubiquitous. So unless we can practice in a vacuum somewhere under the ground or on top of a mountain, we're always going to be distracted by something. And I've just thrown up a few of them there. Right now I can hear birds chirping, I can hear a dog barking somewhere, and where you are, maybe there's traffic moving by, maybe there's people talking, maybe there's kids laughing. So the bottom line is we cannot avoid distractions. And something that I think is really important to acquire as you move through your practice is to recognize that all of these distractions, such as a ticking clock on the wall, are actually your friend in terms of your practice. So the bottom line really, when you think about it, is if you can't tolerate a ticking clock or a dog barking in your garden or next door neighbors having a party, well, then you're not going to be able to tolerate the larger things, such as the COVID-19 pandemic. So what we're trying to do with attention-based training, even at 1, 2, 3, and 4 minute levels, we're trying to train the brain to say distractions are okay. Observe your response to it, which might be irritation, which might be anger, and simply come back to the anchor. And hopefully you would have chosen your anchor by now, which is either the breath or the chosen phrase. So each time you become distracted, you simply return to your anchor. And really the bottom line here is that the reason why distractions are your friends are, as I gave you the analogy in week one, if you go to a gym and you lift feathers, you don't build up any muscle. You need distractions to teach you how to disengage properly. So the ticking clock is your friend, the dog barking is your friend, these distractions are your friends. It also depends on your frame of mind before you go into practice. Obviously, if you're disgruntled or you're a bit anxious or you're upset or angry before you practice, then it's going to be harder to disengage. And that's why we introduce the body scan, so that if you are in that state, you use the body scan. It doesn't have to be as long as the one we did at the start of the session. You can do it for 2 or 3 minutes, calm the system down, and then enter your practice. Bottom line, distractions are your friends. So hopefully many of you will have been able to access the folders online. So there's an attention-based training folder, and each week I'm adding the current week to that, and I'm putting the content in there for the current week. Some weeks will have audio files and some won't. This week has 2 audio files. One is about distraction, so it's a meditation on distraction. And the other one is on this notion of urge surfing. So there's I think there's a 4-minute meditation or practice on urge surfing and how to do it. So I would encourage you to dip into that maybe during the week. And really what I want to do about urge surfing is what I want to talk to you about is that this can be a very useful practice, especially, and if you're like me, you're locked in. I have more of a tendency to comfort eat when I'm in this kind of scenario. So I have to try and stop myself from comfort eating all the time, or just reaching out for snacks, or things like that. When I'm dealing in patient groups, we might be looking at different types of urges that might be emerging. Obviously, if it's in more of an addiction side of things, we're looking at things like smoking or alcohol or things like that. It might be anything. What we're talking about here is how do we deal with physical sensations and impulses that really spurs on to crave something, to either want something to happen or want something to stop. So in terms of pain and discomfort, we want it to stop, and we really hold tight to that. In terms of impulses such as I want to eat some chocolate, we really feel that urge and that push to eat the chocolate. So how can we manage that kind of thing? So the answer is we can manage this with your basic attention-based training practice, but with this notion on top, which is urge surfing. And really what urge surfing is, it's breathing as usual, choosing your anchor, again, which is the breath or your chosen phrase, observing the impulse. So let's stick with the urge to eat, and watch how it rises in intensity. The less you engage with it, it rises like a large wave, peaking and peaking, but you'll notice that eventually that wave will actually reduce in intensity and crash onto your mental beach. And it will move in pulses like this. So what you'll find is when you practice urge surfing as a meditative like practice, you'll find that the space in between the peak waves gets wider and wider and wider until eventually the waves stop breaking onto the beach. And then that period of impulse is over. So the craving tends to be over at that point. So what I'm trying to say to you here is that if you have an urge to eat chocolate, if you can engage in this type of meditation practice, using your anchors and your regular breathing in the usual posture, that you will be able to ride out this impulse, because eventually it will be replaced by something else. So an urge to do something else, or an impulse to watch a TV show or something like that. So I would really encourage you to try and practice this, especially if you are experiencing any difficulty with impulse and urges at the moment. And I've also put the link directly to the folder here at the bottom of the slide. So please give this a go. It can actually be very effective. As I said, it's not just effective for cravings and impulses and wants. It's also effective with pain and discomfort, where we can begin to tolerate this intense feeling to not want something to happen or to want something to stop. So the very last subject of today is something called checking behavior. And some of you may have come across this, some of you may have not. It's something I would see a lot in counseling practice. I see it a lot with individuals with chronic diseases. And really what this is about is an impulse to check that something has been switched off or is safe, hence checking behavior. And during anxious times, we can really engage in more of this behavior than we normally would have. Now, some people are naturally prone to this, some aren't. It's a normal response to anxiety, so there's nothing weird and wonderful about it. But it's something that if we can get a control of, it's one less thing to have to think about and worry about during anxious times. And I've given the example here of, you might go up to bed and think, well, did I leave the lights on, or did I switch the alarm on, or did I put the cat out, or did I let the cat back in, or did I let the dog out? Or what happens to a lot of people in Ireland, and many comedians have made jokes about this, is the immersion. Did I switch it off before I left the house? So if you are experiencing anything like that, I would encourage you to just have a little bit of a think about it, have a look. If you are, here's a way that we can manage this kind of checking behavior. And the example I've given here is from a patient a couple of months ago who gave the example of locking his car. So he parked his car when he got back from work, and he would have to check maybe 5, 6, 7 times that his car was actually locked when he went into the house. And the more anxious he got about life in general, the more times he went down to check the car. And this can be quite distressing, and it can be quite exhausting and tiring, especially when you're tired anyway from being anxious. So I'm going to give you this example of this individual concerning his locked car. Did he lock the car? So imagine that this is you, and I know not many of us are actually getting into our cars at the moment, but bear with me here. Pretend it's normal time. Before you get out of the car, you would spend 30 seconds practicing your breathing, engaging your attention-based training, posture, and practice, and stay in the present moment in the car before you exit. So then when you exit the car, calmly and deliberately, which is the key message here, you need to say out loud. Now, regardless of whether your neighbors are listening or whether there's somebody in the car, you need to say out loud, I've locked this car and I'm not coming back to check it. This is a really important part of the solution to this. And then once you get inside, this is where you can use a practice like urge surfing. And this is where you need to ride out this urge, because this urge will flood into you perhaps 30 minutes later, perhaps sooner. And that gnawing question will be, did I lock the car? You remind yourself that you said that you did out loud, and you engage your urge surfing practice. And the important thing here with any of these behaviors, once you've said it out loud, so you've turned the immersion off, you've turned the light off, you've turned the iron off, you've turned the electric blanket off, you don't go back, because you've already confirmed to yourself that you switched this thing off. So as I said, all these behaviors, they combine to really add to the whole anxiety world. And if we can even remove 1 or 2 of them, then anxiety drops that little bit more down to a manageable level. And the point here is that you can use the attention-based training practices to manage these kinds of behavior. This may not be an issue with you at the moment, but it may be for somebody you know, so you can advise them with this practice. So here we are just towards the end of the session, and we will go into the Q&A session. But as usual, I want us now to practice for 2 minutes again. Again, this is not the body scan. This is our standard attention-based training practice. This is the core practice that we do morning and evening for the duration of the program and hopefully beyond. So again, what I'd like you to do is adopt the upright position, feet firmly on the ground. You can close your eyes. Again, take a deep breath in. And remember, each time you become distracted, you simply return to your anchor and wait for the timer to go off after 2 minutes. Okay, so that's the end of the short 2-minute practice. I put a big number 4 here, Sesame Street style, so that we know exactly how much practice we have to do this week. Don't worry about it if you haven't managed to reach your 3-minute morning and evening yet, but this is our target this week. If you remember, this practice is like a dose response of any type of drug. The more you use it, generally speaking, the more you're going to get from it. So we're rising up this curve now, and 4 minutes is the target in the morning and in the evening. And if you get a chance then during the week, what we'll do is you'll try and incorporate, maybe have a listen to the Urge surfing audio file, have a listen to the distraction audio file. Write down the barriers, remember, to your practice if you're having difficulties. Hopefully we'll have someone to chat to at the end of this in the Q&A session. Use the Urge surfing when your impulses are strong, for example, the urge to comfort eat. 4 minutes. Hopefully your anchors are chosen now. Close your eyes and you know what to do. I'm going to bore you to death with this phrase by the end of the 8 weeks. No such thing as good or bad practice. There's just simply practice. And remember that you can't stop any of these things. Your job is to look on distraction as your friend and your teacher, and you disengage using your anchor. Okay, so thank you very much for the presentation part of today. So hopefully we'll just have maybe 1 or 2 people just to join in on the chat part, so we can discuss a few questions maybe.
Hi, Pork. It's Jane here. I see a question in from Amanda. So she was looking for guidance on the type of breathing that should be used during the body scan.
Sure. So thanks, Amanda. So really, there's no fancy type of breathing. I know there's an awful lot of emphasis out there on different types of meditation practices, and just even relaxation practices about different types of breathing. So box breathing and abdominal breathing, and they're all great. But for me, the type of breathing that you should be engaging in the during the body scan is just regular, old-fashioned in and out. Don't worry too much about it at all. The point of the body scan is to bring your attention into the body. So to bring what's happening in here into the body, because generally we walk around like we're large giant heads with a tiny little body, when the reality is we have a body that needs to be really integrated with the head. So I think just regular breathing, you don't have to worry too much about it. Hope that makes sense.
Great, thank you. At the moment, there's no other questions unless anybody would like to post them up and we can share them.
Yeah, maybe we'll just give a minute or so for anybody to put up a question if you have it. So you can just hit the chat section at the bottom of the screen if you have a question. No, seems like everybody's good. Thanks, Amanda. Okay, so thanks very much, everybody, for joining in today. Hopefully you got something out of today's session. And do check in if you have any questions. You have my email address, and if you have any issues accessing the folder, please let me know as well. I see somebody here has, when do you use the anchor? Okay, so yep, that's a good question. So the anchor, so by now hopefully you will have chosen which anchor is for you. So you'll have tried either the breathing, so you're just following your regular breath, or you'll have followed what's called a chosen phrase. An example of the chosen phrase I gave was "I am here now." Now there are lots of different types of mantras or chosen phrase, but that's the one I gave. So if you're using the mantra, it's "I am here now" in inhalation and "I am here now" in exhalation, and you're saying it in your mind over and over. That's the thing you hold on to when your mind is jumping all over the place. So it's either the chosen phrase or the breath. Again, no fancy breathing, just your normal breath. You hold on to the breath, you remind yourself you're breathing. That's what you come back to. So each time you become distracted, you come back to this anchor. You choose one anchor and you stick with that for the rest of your life, or your practice life anyway. And so, for example, if I'm sitting and I close my eyes and I start the timer, and I have a thought of, oh, I'm hungry, I wonder what I'm going to have for dinner. So if I allow that thought to activate and allow the other dominoes to fall, before we know it, I'll be in a narrative about having a mushroom omelette with certain types of spices, and then I'll be thinking about what I'm going to buy tomorrow, and how come I can't go to Aldi tomorrow, and I'll be in this giant narrative. So in order to stop the dominoes falling and prevent that narrative from developing, I hold on to an anchor. So in this instance then, I use my breath. When that thought comes in, what will I have for dinner tonight? I disengage from it and I come back to my breath. The thought will come up again. What am I having for dinner tonight? Again, I disengage, I come back to my breath. I may have to do that many, many times, and then that thought will be replaced by another one, or an itchy foot, or something like that. I hope that makes sense. Okay, so I think we've reached the end.
More questions.
Oh, sorry, more questions.
Yeah.
Sorry,
so
right.
Can you see them, or will I call them out?
Let's see. Yeah, I'm not.
There's one from Amal, and she was asking. They were asking, can these activities be done at any time of the day?
Yeah, absolutely. Yeah, thanks, Amal. Yeah, so generally, the discussions we will get into at this point, again, if we were in a roundtable discussion, would be that you have the practice that bookends your day. So the morning and the evening, or if you're on a shift work, whenever that bookend is, they're the things that wipe the slate clean before you go to bed and start the day on a good setting in terms of a calmer setting, right? So that's your practice. And your practice time will increase morning and evening as we go through the program. However, that doesn't mean that you can't use the practice during the day. So if you're having a difficult time at 12:45, well then, if you're in a busy workplace in normal times, you could go into the loo or escape somewhere to practice your 2 minutes. Or if you're at home, you just take that time out to engage that 2 minutes. So the bottom line there, and the short answer to your question is, you can engage this practice at any time of the day, but you need your bookended practices to help you develop the larger base. So I hope that makes sense.
And there's one more question then as well. Somebody was asking, during the practice, what do you think about without consistently thinking about the anchor?
What do you think about? Well, I mean, in my mind is usually a storm of 1,000 different things that are usually mundane and random. So when you progress into maybe, like, for example, I tend to do between 20 and 30 minutes. When you get into that amount of time, the mind, it doesn't stop, obviously, but it becomes a little bit calmer. It tends to throw up a little less random things. But the mind is always moving. It's always random. You try not to think about anything. What you do is you observe the thought and you disengage. You observe it and you disengage. You observe the emotion, the memory, the sensation. So you can't stop them, but you come back to your anchor. And the anchor is the thing that you hold on to. That's the thing that stops you getting dragged off into a narrative. Now, if you're like me, you'll get dragged into a narrative, and before you know it, you'll be daydreaming for 2 minutes and be floating down a river somewhere. When that happens, you simply return to the anchor. And you might have to do that 100 times in 60 seconds, but that's what the practice is. And that's what I mean when I say there's no such thing as a good or a bad practice. It doesn't matter how many times you get distracted, as long as you keep coming back to the anchor. And it's that action of coming back that is training your brain to focus, to be attentive in the present moment.
Okay, thank you, Padraig. Another person had inquired about where the ABT folder was, so I've just shared the link in the question and answer session to the folder that you've shared.
Great, thanks very much. And if you're ever looking for any of these folders or any of the links to the past sessions, if you go to the WorkVivo page and you just type my name in, you'll see all the links should be there anyway. Or just email me. That's good too. Thanks again, Bahrain. It's great to have you guys here. As usual, hopefully you'll be here for the long haul. So I think, is that pretty much it, Jane? Are there any other?
Oh, sorry, coming in now. Somebody was asking, was a link shared for last week's material and this link? Yeah, I'll respond to that. I'll send them the link again. Yeah.
Great stuff.
Yeah. So that's it. Yeah, I think so.
Okay. So thanks very much, everyone. Again, it's great to do it. It's a pleasure. And we'll see you next week.
Thank you.
Take care. Bye-bye.